Hello everyone, this is a One World YouTube segment on signing up for the Affordable Care Act. And we have some people here who are going to tell you why it is so important. We're going to talk a little about a piece that we didn't focus so much on in our regular program. Maria Damiani has joined us, and she's going to be talking about the HUSKY program and how the maternal and child health unit can provide great assistance to you. And so we have Maria Damiani, we have Daisy Sanchez from Community Action Agency, and we have Denise Smith from AccessHealthCT. So Maria, why don't you tell us why it is so important, what are the key things people need to know about the role of HUSKY in Access Health and your department, the key role your department plays?
So the first thing I would like people to know is that I am an employee of the City of New Haven, and I'm the director of the Maternal and Child Health Division for the city. We are also the South Central Regional Administrator for HUSKY, and our target population is women and pregnant women, postpartum women, and children. Although we also enroll families, and it's a lot of it is contingent upon income, and our connection with Access Health. I think one of the reasons why we became the Navigator organization for New Haven County was because of our experience working with the HUSKY or Medicaid program. And so I think the important thing to know is that it's different, and we're very focused on a specific population. And although we also do the Access Health enrollments as well.
No, you see, you're focused on a specific population. You meaning women, pregnant women, and women with small children.
Well, not even small children, children up to the age of 9. We enroll up to the age of 19. And the thing about the HUSKY program at the Maternal and Child Health Division is that we're really, it's really called the Healthy Start program, because we have so many connections to services, and my staff also provide short-term care coordination and case management services, home visitation services as well. So it's a whole menu of services that come with that. And HUSKY itself is the gateway to healthcare and to prevention, and so that we can enroll immunization. I mean, everything that's involved with healthcare. It's really important for us to have that first stop, or the gateway to a medical home. So
are you telling me that there's absolutely no reason at all for women in New Haven, for pregnant women, not to have health care?
Every woman in New Haven should have health care, because there are a variety of programs that are available. So it could be the HUSKY A program. It could be a program that's run by Yale New Haven Hospital, which is called Me and My Baby. It could be also the financial assistance programs that are run out of both hospitals as well.
Suppose a woman is earning $50,000 a year and has, had never signed up for health insurance, and that woman has 2 small children. Can she come to the Maternal and Child Health Unit at your department and sign up?
Yes. Now, she at $50,000 with 2 children, I would have to look at the income guidelines and the percent of we call it the federal poverty level, and she might be over that with 2 kids. And I don't know, is she married? Does she have a husband also living with her? So we would do an assessment and see if she's eligible, and if she wasn't eligible for HUSKY, then we could certainly shift her to the Access Health program.
Okay. Exactly. Daisy, you are a certified assister with Access Health, and you work for the Community Action Agency, and the Community Action Agency offers assistance to people who want to sign up for AccessHealthCT, and you deal with a range of clients. What is it important for them to know? You're also bilingual, so what is it important for people watching this segment of this program to know about coming to your agency to get help?
that Community Action Agency of New Haven, we, besides having three certified assisters through AccessHealthCT, we also provide assessments for other needs that the client may need. We have energy assistance program.
Oh, yes.
Plus, we also may give referrals out for other locations when the client have other needs. So besides Access Health, we can also assess them and referring them to other
So community action has more of a range of services.
Yes.
As you said, you provide heating assistance.
That's correct.
And you can help someone to get evaluated to see what are their socioeconomic needs, not just health care.
Exactly.
But you certainly do health care. And you're bilingual. So you want to tell people in Spanish that they can come to Community Action Agency to get help, please?
Okay. Community Action Agency de New Haven es una organización sin lucros y estamos disponibles de lunes a viernes de 9 de la mañana a 5 de la tarde. Nos puede llamar para cualquier asistencia, cualquier pregunta que usted tenga sobre el seguro de salud o si tiene alguna necesidad de energía o otros problemas que tenga. Puede llamarnos a nosotros al 203-387-7700 y nosotros le podemos ayudar en cualquier algo que usted necesite.
Gracias. Denise, tell us what Maria talks with great passion about Husky and getting help. Tell us, you're from AccessHealthCT, and you're the trainer coordinator for the assisters as well as navigators.
Yes.
And I know you're extremely knowledgeable about this. Tell people for this YouTube segment why it is important for them to sign up before March 31st for Access Health and the important role of prevention, disease prevention in Access Health.
Sure. So the open enrollment period for the health insurance marketplace, and for Connecticut, that's AccessHealthCT, is March 31st, 2014. We want people to enroll as soon as possible because the sooner you enroll, the sooner you'll be able to access health care, the essential health benefits and protections that are available through your new health insurance plan. Through Access Health, as it has been said, you're able to determine eligibility for the Husky Medicaid programs or for financial assistance for a qualified health plan. It's fantastic to be with the navigator and assister today because what you heard, it gives you insight into the great depth and diversity of the navigator and assister programs that are occurring throughout the state. You heard that the New Haven Health Department provides a range of assessment and services to connect people to a patient-centered medical home. You heard about the social services that are offered at the Community Action Agency. And all of the assister and navigator organizations that are working for enrollment purposes as part of AccessHealthCT all have that unique skill and ability to connect you to the services that you need. So health insurance coverage is an important indicator for your overall health, but there are many other services that we know you can now gain access to through this program.
Yes, I am so glad you brought up that point because, you know, we have heard so many negative things being said about Access Health. We have heard people saying, oh, the president wasn't telling the truth when he said if you like your insurance, you can keep your insurance. But in fact, at the time when the president said that it was his intention for people to be able to keep their health insurance, what he didn't know, I think, is that there are many insurance coverage that doesn't provide all of the basic needs in the coverage that the Access Health program, that the Affordable Health Care program does. And the Affordable Health Care program wants you to have the best basic service. And there are 3 tiers of service. There's bronze, silver, and gold.
That's correct.
Okay. And that means, you know, a tier means a certain level of service, and it costs a certain amount of money. any health coverage program you have should at least cover the basics. And,
Yes.
And is that the bronze plan?
Yes, all of the plans that are offered
Cover the
through
basics, right.
AccessHealthCT offer the 10 essential health benefits. So that's the good news. The difference in the plan tiers, bronze, silver, or gold, relate to the percentage amount that the consumer will pay for a premium and the amount that the health insurance carrier is going to cover for those services.
Yeah, and it also includes the copay or deductible, the rate that you pay. And that's really another important thing, is that if you sign up through AccessHealthCT, whether in the health department or in community action agency or any other place in Connecticut that is certified to provide you this assistance, they will help you to, especially the brokers, will help you to identify what are the needs of your family. You know, how many people are in your family, who needs health care, what kind of care they need, so that you can plan adequately for your family's healthcare needs down the road. The assisters will tell you by calling the number that we're now showing on the screen. The assisters call the number, leave your name and your phone number, speak slowly, speak clearly, so they can copy it down, and they will call you back and set up a time that is convenient for you to come in. They have people who speak several different languages, and they will be able, you tell them what language you will need assistance in, and they will find a translator for you, someone who can communicate with you adequately. And so when they set up a time with you, you will be meeting with someone competent, culturally and linguistically competent, to provide the assistance you need so that you can get health care for you and your family. That is not normally offered when you just go to pick a plan from a private insurer. So that's what covering the basics mean. It's not about taking away anything that you have. It's giving you something, a minimum at least of all the basic, the 10 needs, the 10 points that you should have at the minimum. That's critically important. So we want to stress that this is something you should at least call up and get an appointment and learn about it before you make a decision. And that's true for you, whether you're 25 years old or 55 years old. What's your closing comment?
Well, I'd like to emphasize that and encourage anybody that's listening to this program to call either
tell us the phone number.
You could call me. I'll give you a telephone number that rings directly at my desk, which is 203-946-5842. I also want to stress the fact that the program at the health department is not just for New Haven residents. We provide services for the New Haven region. Now, that's not the entire county. Although it is, we can do that with Access Health, but it is the New Haven region. So if you live in East Haven or West Haven, Milford, Branford, and if it's outside of the region, even up to Hartford, we have colleagues all over the state.
And you can connect people to.
We can connect them to. We can connect them to the Department of Social Services. We can troubleshoot problems that may be occurring, because this is a huge undertaking, the rollout of the Affordable Care Act. So we have very experienced staff and bilingual, and access to translators in many different languages, because we work very collaboratively with Yale New Haven Hospital. The other number is for the division that I oversee and direct, which is the Maternal and Child Health Division. And that number is 203-946-8187. And someone's always there to answer that line 9 to 5. We'll set up an appointment, let you come in, talk to you about what you might be eligible for, and make sure that we can hook you up.
Okay, thank you. Denise, you have 30 seconds.
Okay, remember to sign up for health insurance coverage through AccessHealthCT.com or to call the call center 1-855-805-4325. It's the only place where you can find out if you're eligible for financial assistance to help pay for your premium. Reach out to the New Haven Navigator or the assisters, specifically Daisy at Community Action Agency, for private and confidential and certified in-person assistance to help you enroll.
Can I just say one quick thing?
At the
really
Community
important?
Action Agency, 1 minute. At the Community Action Agency, we have 3 certified assisters, not just Daisy, but there are 80 certified assisters throughout Greater New Haven. You have 10 seconds.
I just want to say that the Access Health has an enrollment period, but our program at the New Haven Health Department, which is the HUSKY A, B, or Medicaid program, it doesn't have an enrollment period. You could come in anytime after that. Right. So I just don't want people to be confused and think that that program also closes for enrollments on the 31st of March. Come in anytime. We're always there.
And the same is true for Christian community, for Community Action Agency. You are there, your agency goes 12 months a year, and you're open all the time, although you're open some extra hours for Access Health, but you're open all the time. And you can provide heating assistance, all kinds of assistance. You help people to evaluate where they are and what their needs are, and find them the help they need. We're not taking away, the Affordable Care Act is not taking away anything from people. It's actually trying to ensure that people have all the basic needs, their basic medical needs met. And for example, pre-existing condition, if you suffer from asthma, for example, they cannot raise your premiums just because you have asthma. You can get coverage. That is so important, because I know I was asked recently about that. There are people who have been taken off plan and people were kept on, and we noticed that there were different premiums people were paying. So it seems as if the insurance companies are cherry picking who they want to keep and who they don't keep based on what they're paying and based on what the plan offers. Thank you very, very much. We thank you for watching this segment. Visit the One World website. All of this information will be on our website and will be provided for you so you can get the help you need. We're glad you join us for this YouTube segment. Visit us on Twitter. Follow us on Twitter and visit us on Facebook. And tune into our YouTube channel where you get a lot more information. Good night, everyone.